Hello everyone, this is Chadi Alraies from CBI 2022 in Denver, Colorado. I'm really privileged today to be with Dr. Shirling Tsai. She is a vascular surgeon from Dallas VA UT Southwestern. Good to see you. Thanks for being with us.
Yes, thank you.
So it's unusual to have a vascular surgeon at Interventional Cardiology Society, but your expertise and being involved with all the work we have been doing is really appreciated.
Oh, thank you. Actually, I got into this because I work closely with Dr. Banerjee, who has been a fantastic resource for me. Ever since I got to the VA, he's been just an amazing, he's been a mentor, he's actually a really close friend of mine. My kids, I'll call him like my only friend, actually. But yeah, I've come to this meeting for years now. Ever since it was just a meeting in Dallas, I've been there, and now I've just seen it grow over the years, which is really amazing.
It's great. Yeah.
Congratulations to him.
Thank you. So you have a talk today about DCB, and I know it was controversial like 2 years ago about the use of DCB in the peripheral space, but now things were coming back. So what do you think?
Yeah, I think it. I remember when DCB first came out, and it was like everyone was so excited about it, and we all used it, and it was a little bit odd because we only got the balloons in like 40 or 60, but we try to treat this long SFA thing, and we'd be using like 4 or
multiple.
Yeah. But we used it and we thought it was fantastic, and then this meta-analysis came along and it just sort of squashed all our enthusiasm immediately, right? But then you go back and you look at it and people were like, well, the studies weren't done right, but like no one ever really had the same enthusiasm for it that we at first had. And now we have so many studies that show that really probably there shouldn't be a concern. Just and there have been good studies, right? Population-based studies in the U.S. and in Europe. None of them have shown any mortality signal, but I don't think you'll ever have the same enthusiasm for these paclitaxel-coated devices as we did when they first came out. But we use them. I think the data is good. That shows it's especially for the drug-eluting stents, that and the DCB also. I think they do help in terms of restenosis, but I don't think the enthusiasm will ever come back. And I think it has actually propelled us towards finding more stuff, like all the limus-eluting drugs.
Right. So in your practice, how do you use them? Which patient will
I do use them. I use them if there are cases where I really try not to stent. So patients with like primarily popliteal disease or like really bad outflow. So single vessel runoff, where I don't think that it's going to be a great idea that outflow will not support a stent. I try to not stent, and then I'll try to use DCB.
DCB. So that's why you narrow your indication to that kind of cohort of patients.
Yes.
In terms of space, below knee, above the knee, what's your preference?
Yeah, I think SFA popliteal. I don't really have any experience with the tibial DCB, and I don't think we have it.
Yeah.
But SFA popliteal, I'll do it.
Iliacs.
Not for the iliacs, no. I'll do it for like in-stent stenosis. Sometimes I've done it for bypass graft stenosis because some of these people come back with bypass graft. I tried the first time with regular balloon angioplasty. The second time we tried with a DCB. The third time I'm like putting in a coronary stent or something, and then I just tell them you're going to need an open revision.
I see. All right. Well, at least the DCB are coming back, as you said, but indication and enthusiasm is down. And patient selection is very important.
Yes, I think so.
Yeah. Well, thank you so much, Dr. Tsai, for your time.
Thanks for having me.
Absolutely. Thank you. Watch this video and others on CBI YouTube channel. This is Chadi Alraies from Denver, Colorado. Thank you so much, Dr. Tsai.
Thank you.